Hello, my name is Professor Richard Schilling and I'm a cardiologist practicing at the London Independent Hospital, and I specialise in heart rhythm problems, and in this video I'm going to talk to you about atrial fibrillation, or AF. Now, AF is the commonest abnormal rhythm problem. It affects about 1% of the population and about 10% of the population over 70, so it gets more common as you get older. A lot of people ask us what causes atrial fibrillation, and while we know that there are some factors that help to trigger atrial fibrillation, for example alcohol, the more alcohol you drink the more likely you are to have atrial fibrillation, in many cases it's not clear why the patient's got it. Atrial fibrillation is a situation where the top chambers of the heart, the atria, go into a chaotic and abnormal electrical heart rhythm. This prevents the atria from contracting normally because all of the cells in the atria are squeezing at different times. Now, the atria is not essential for life, but for many people functions a bit like a turbocharger for the heart. This means that when they go into atrial fibrillation, they feel that they can't exercise and perform to the same level as they can when they're in normal rhythm, known as sinus rhythm. The other problem with atrial fibrillation is that the atria have a blind alley within them called the appendage. And if this blind alley is not moving and contracting, blood can stagnate within it and form clots, which can fly away and cause stroke. Therefore, the main priorities for management of AF is to prevent stroke using blood thinning drugs like warfarin. This is used in patients who are at high risk of stroke, for example, patients over the age of 65 or patients with high blood pressure or other forms of diabetes or structural heart disease. The second priority for management of atrial fibrillation is to slow the heart rate down, because this chaotic electrical activity can make the main pumping chamber of the heart, the ventricles, beat faster than it should do. Drugs that we use for this sort of thing are drugs like beta blockers or drugs called calcium channel blockers. The third priority for atrial fibrillation management is to try and stop the rhythm happening and restore normal rhythm. The normal way we do this is to give patients a brief anaesthetic and then restore normal rhythm by giving an electric shock to the heart to reset it. This sounds very dramatic, but it's a very simple and straightforward procedure. The problem with this process, which is called a cardioversion, is that it doesn't change the electrical properties of the heart, so unfortunately the atrial fibrillation will often return. Other ways of managing this are to give anti-rhythm drugs, drugs like flecainide or amiodarone. These drugs can be effective in some patients, but in many patients they fail to control the AF and they have side effects, some of which can be dangerous. For this reason, many patients who have symptoms go on to have a procedure called a catheter ablation. This is a minor operation which you'll hear more about in another video by my colleague Mehul Dinoja. What we know about catheter ablation is that it is much more effective than drugs in preventing atrial fibrillation, but we do not know whether catheter ablation is safer than drugs, and these research trials are going on at the moment to answer this question. Therefore, if you have atrial fibrillation, restoration of normal rhythm is really only indicated if the atrial fibrillation gives you symptoms. It may seem obvious, but some patients don't get symptoms from atrial fibrillation and are completely unaware of it. And in those patients, the best treatment is simple stroke prevention and heart rate control. Finally, when deciding on your treatment for atrial fibrillation, it's important to make sure that you see a heart rhythm specialist, such as may be available at the London Independent Hospital. It's only those doctors that know the real risks and benefits of treatment available to you and how they would apply to your personal case.